So you're the patient first or what?
Sure.
Huh? So go ahead. So I don't know how to do this. So I'm making motion first and then emergency. So forget.
I'll tell you what's your
Oh, ankle. No, let's do hip first. I'm more comfortable with hip.
Well, that's why you start at the ankle.
Okay, let's start with ankle. Alright, so go ahead and take off your socks.
Oh, go.
So range of motion for ankle first. Or MMT. Range of motion. That's supine, right? Alright, so we'll be checking your range of motion for your ankle. So dorsiflexion and plantarflexion. So we'll go and zero this out. Smooth work, certainly. At the edge, yeah. Start to do that. So you have wellness. Go ahead. The way Miss Dennis does it, I like the way she like put her finger here or something like that. She was able to. Degrees. Alright, go ahead and point your foot, your toes to your nose, please. Go. Alright, relax. So we got about 10 degrees. We'll just say that 10 now. Right. Yep, I can leave it here right now. plantar flexion, same thing, right? Start at 90. Up. All right, go ahead and put your toes to the ground, please. Relax. 46, 47. Yeah. Okay, so that's plantar flexion and dorsiflexion. You would start off with range of motion. So go ahead and stand up here, please. And we're going to be testing your muscle strength on your right leg, okay? Of your calf muscles here. So what I want you to do is, with your left hand, you just be placing 2 fingers on here. You're going to flex your left knee and make sure that right knee stays completely straight, okay? And what I want you to do is go ahead. Huh?
Taking my socks all over the place. There's the other one.
That was me. All right. So we're going to be testing your calf muscles on your right leg. Okay. So for that, go ahead and place your 2 fingers on the left hand on the table over here. Left leg, I want you to flex like this, and go ahead and go up as high as you can go. All right. Go ahead and go back down. What I want you to do is you go up, down. That's 1, up, down. 2, up, down. 3, keep that pace for me. Up, down. Do as many as you can. 4, 5, 6, 7, 8, 9, 10. Just 2 fingers. 11, 12, 13, 14, 15, don't place any weight on there, 16, 17, you're placing too much weight, 17, okay, so that would be a 4. Okay, go ahead and lay down over here, please, with your feet hanging over here. And scoot back, so just your feet are hanging out. So next, what we're going to do is we'll go ahead and test the strength. All right, okay. The strength of your muscles are over here in the front, your anterior portion. So what I want you to do is punch your toes all the way up, get the knee nice and straight, all the way up to your nose. Take from there. I don't want to block this. So go ahead and point your toes to your nose. All right. So that's range. Go ahead and relax. So half range is about right there. So I'm gonna add some resistance here. Don't let me move, okay? All right, ready? Don't let me move. Don't let me move. Don't let me move. Don't let me move. All right, that's 5. So go ahead and give me another one. Go ahead and point your toes to your nose. All right. So go ahead and relax your foot. Mid range is about right here. Wait, was it up? It was up and out, right? So up and in. Don't let me move, don't let me move. All right, so that's a 4. Go ahead and do it again. Toes to your nose. And in. So what would you say for dorsiflexion?
Yeah, that's dorsiflexion.
Okay, in.
Up and in.
All right.
And plantar flexion down and in.
Yeah. So up and in. All right. Don't let me move, don't let me move, don't let me move.
Sorry.
That's a 4. 15 up, in. Hold it right about right there. All right, don't let me move, okay? Okay, that's a 3. So next, go ahead and do the motion again for me. So that would be a 2. It's partial range. Next, I'll show right here. Go ahead and go. So I see the ligament kind of popping up there. So that would be a grade 1. Well, I guess, yeah. And then grade 0 would be no movement here. Or no visible. Oh, relax, relax. So grade 0 will be no movement at all while she's trying to actively dorsiflex her foot here. Okay, now for plantar flex, or I guess we'll do the measurement here. So we're going to be measuring inversion first. So it's this motion right here, okay? So you find mid. Oh, this is like this, right? This one's in sitting also?
That I don't know. Has been removed. It's sitting or something.
It's hard to remember all of these. I think you could do either or, right? I think it shows it in sitting. Yeah. And the manual muscle test is for that sitting. Okay, so far we've done manual muscle test and goniometry for both dorsiflexion and plantar flexion. Now we're about to do manual muscle test and goniometry for inversion and eversion. And the foot is in neutral position here? Or do I put the foot in resting position, or do I put the foot in neutral?
Place the individual in the sitting position with the knee flexed 90 degrees and the lower leg over the edge of the sitting surface.
Alright, so what I want you to do is you're going to go ahead and point this big toe towards your other foot, just like that, okay? So go ahead and do that motion for me. There we go, perfect. So now we find the two malleoli. We place the fulcrum right in between both malleoli. You align, is this the distal arm or the proximal arm? This is the proximal arm. So you align the proximal arm to mid-patella or the tibial tuberosity right here. And you align the distal arm to the second met head right over here. So you want to get your patient into neutral position, which is going to be 0. So right there. And remember that motion I want you to do, foot towards the other foot. So go ahead and do that same motion for me, please. Okay, go ahead and relax. So for inversion, I got about 35 degrees. Would you agree? So 35 degrees is going to be normal.
Oh, okay, yeah.
Okay, so now let's go ahead and test manual muscle strength for inversion. So with this foot, you ask the patient to go ahead and make the full range of motion. So go ahead and relax your foot. Go ahead and point this toe towards this other foot for me. There you go. So you see that she's able to do full range of motion. So that means you can start applying resistance to this foot. So with this, you want to point the toes. Remember?
Was it plantar?
Yeah, plantar flexion. And in, you find mid-range, so about right here. You stabilize the distal part of the fibula, and you apply pressure out and up. Right? Okay. So I'm gonna go ahead and apply pressure. Don't let me move, okay? Don't let me move, don't let me move, don't let me move. All right, so that's maximal force, and she did not break, so that's gonna be a grade 5. So next we'll go ahead and do another grade. She's not going to let me know what that grade's going to be. So same thing. Go ahead and point this toe towards this foot over here. You see that she's able to go full range. Next, you slight plantar flexion and inversion, mid-range. So right about right here. Don't let me move, don't let me move. So she broke right away. So that would be a grade 3. All right, so go ahead and point this toe towards this foot over here for me, please. Okay, so you see that she's not able to do that. I did not see any muscle contraction. So just to be sure, you're gonna palpate just distal to the medial malleolus and ask her to perform that same motion. Go ahead and perform the same motion. So I did see some muscle activation there. So that's gonna be a grade 1. All right, so we're gonna do this. So you give me grade 5, give me grade 3, and you give me grade 1. So go ahead and point this toe towards this one for me, please. So you see that she's able to go full range. By mid-range, so that's about right here. Again, stabilize the distal fibula. I think they grab the foot over here. All right, don't let me move, okay? I'm gonna apply resistance, don't let me move. So she broke, that's a grade 3. So she's giving me 2 grade 3s now. All right, so do the same thing. Go ahead and point this toe towards this foot over here. So you see that she cannot do that. So same thing, you're gonna palpate just distal to the medial malleolus. And go ahead and point this toe towards this foot for me. So you see no muscle activation, nor any movement there. So that's gonna be a grade 0. There's only one more grade left, but we'll go ahead and go through that motion. So go ahead and point this toe towards that foot for me. Here we go, thank you. Can you find inversion? So I believe you grab the foot like this. Let's do it. So it is like that.
Yeah, I guess it makes it easier.
To me, it's usually like this. So like this. All right, so go ahead and point your foot this way. We're gonna hold it about right there. I'm gonna add resistance this way, so don't let me move, okay? Don't let me move, don't let me move. Oh, so she broke. So that's about a grade 4. I don't like that. I prefer holding it like this. Okay, so that was inversion, manual muscle test. Now we're gonna do eversion, goniometry. Excuse me. All right, go ahead and relax your foot. Same thing. Find both malleoli. We're gonna put the fulcrum in between both those malleoli. You're gonna align the proximal arm to her tibial tuberosity, right there, and then the distal arm, you're gonna align it to the second head right here. And since it's not at 0, you go ahead and 0 her out. There we go. Before we do any of that, you ask the patient to perform the motion just to make sure she's able to go through the motion. So what I want you to do is point your toes outward just like that, and go ahead and perform the motion for me, please. There you go. So you see that she's able to perform the motion. Go ahead and align everything between both malleoli, tibial tuberosity, second met head, take her to 0, and go ahead and perform that same motion for me, please. So this one did slightly move. Go ahead and make the proper adjustments. Go ahead and hold that for me, just right there. All right, go ahead and relax. So she got about 20 degrees. Would you agree? Did I stabilize with it? try that one more time. All right. So go ahead and perform that motion where you bring your foot up. All right, go ahead and relax. I got 15 degrees there. I think I didn't stabilize correctly the first time. So let's go ahead and try one more time. Working on the O-line. Open right there. Just a tuberosity. Second mid-hip. Right there. And go ahead and perform that motion where you twist on top. Okay, go ahead and relax. Alright, just like, dang it, let's do that one more time. Circle out. Alright, go ahead and perform that motion. And relax. Yeah, so about 16 degrees. Do you see anything I'm doing wrong? Yeah? No, but you see, like when I'm doing it. So 15 degrees of eversion is normal. So she's about that range. Okay, so now for manual muscle tests. Grades 0 through 5 are going to be in this position right here. If the patient is not able to stabilize, you could have her in supine for grade 0 through 2. Or grade 0 and 1, right? Grades 1 and 0 should be in supine.
Sitting or supine. Could be either one.
Yeah, sitting or supine. No, but I say like grade 0 through 5 be sitting. If they can't stabilize core or trunk stabilization, then you would have them in supine for grade 0. Or if they cannot tolerate sitting. So for this one, you're going to ask the patient to perform the motion. You can go ahead and passively do it for them. So what I want you to do is go ahead and do this motion for me right here. So just go ahead and put your foot out just like that. Go ahead and ask the patient to perform that motion actively. Go ahead and punch your toe out so you see that she's able to go through full range. So for there, you see you would see that she's at least a 3. So from here, I'm going to put her in slight plantar flexion. Point the foot out, take her to mid-range. You're going to stabilize the back of her ankle. Grab the forefoot, and the resistance you're going to apply is going to be up and in. So she's going to be resisting that motion right there. So I'm going to go ahead and apply that force. Don't let me move, okay? Don't let me move, don't let me move. Wait, up and in. Don't let me move. That's awkward. That hurt you? It does? Maybe this is easier.
Yeah, just do that. Just do that.
Alright, so I'm going to go ahead and apply this force over here, okay? Don't let me move, alright? Don't let me move, don't let me move, don't let me move. So since she did not break with maximum resistance, I would grade that a 5. So now same thing, ask the patient to perform the motion. Go ahead and point those toes out. You see she's able to go through full range, so you know that's at least a 3. I'm going to go ahead and apply some force, okay? So go ahead and keep that motion for me right there. We'll be pushing in and down, up and in, okay? So don't let me move, right? Don't let me move, don't let me move, don't let me move. So it's about moderate to max resistance, and she broke. That would be a grade 4. I guess kind of like a 4 plus, since it took a while for her to break. So same thing, go ahead and perform that same motion out, full range, apply resistance, put her to mid range, apply resistance, go ahead, don't let me move. So she broke right away, so that would be a grade 3. All right, so go ahead and perform that motion again, toes out. Maybe do it again. One more time. So that's about partial, right? That's a lot of cueing right there. I was like, whoa. That's kind of hard to see. So let's see one more time. So that's about partial range. So that's going to be a grade 2. All right, same thing. Go ahead and perform this motion for me. Go ahead. So that's full range.
That's not full range.
That's not. To me, that's full range. That's full range. Let's do it again. So that's a grade 2. So grade 2. All right, go ahead and perform that motion. Go ahead and put your toes out. So you see that she's not able to perform that motion. In this instance, you're going to go ahead and palpate just lateral, below the lateral malleolus. So go ahead and perform that motion for me. So I did see a little bit of movement and some muscle activation right here. What is the term? So the fibularis brevis and longus, I would assume. Just brevis. Okay. So since I did see some muscle activation there, some contraction, I would grade that a 1. Same thing. Go ahead and point this toe out for me. So if she's not able to do it, same thing. Go ahead and palpate just below the lateral malleolus. Go ahead and perform the same motion for me. So I do not see any muscle activation nor any movement. So that would be a grade 0. So that was manual muscle testing for E version of the foot. So we've done all of the ankle except for the rear foot. So next, you'll be able to test both plantar flexion, grades, I believe it's 2 to 0 in prone, as well as the subtarsal. Is it subtarsal? Subtalar. Both N version and E version. So for plantar flexion, it's prone. Yeah, grades 0 through 2. Yeah, it does. No, for ankle. For the plantar. So there's 2. Okay, let's go ahead and do that. You know? Yeah. So grade 2 is maximal resistance. You can hold it. Grade 1, I would presume. Grade 0 is that. All right, go ahead and make pumping. Stood up for me. I'm testing which one this is the whole time, right? So for here, go ahead and point your toes to the wall like a ballerina. So you see she's able to go to full range. Go ahead and relax. Take it to a partial range. All right, I'm gonna apply resistance. Don't let me move, okay? Don't let me move. So that's maximal resistance. So that would be considered a grade 2. So go ahead and point the toes like a ballerina down. So you see there, she is not able to go through full range, not even partial range. So you would palpate right here just above the Achilles tendon to see if there's any muscle activation. So go ahead and perform that same motion for me. Toes towards the wall like a ballerina. So I did feel a contraction and I did see some muscle activation as well. So due to that, I would give her a grade 1. So you ask the patient again, it's for a different grade, to go ahead and perform the same action. So go ahead and point your toes towards the wall like a ballerina. So you see there's no muscle contraction, no muscle activation. But just to be sure, you go ahead and palpate just above the Achilles tendon right here. So go ahead and perform that same motion. So she's not able to do that motion. I don't see a contraction, nor do I see any activation of the muscle right here. So that would be your grade 0. Next, we're going to go ahead and be measuring the subtalar inversion and eversion. And to get this measurement, you could either use a small goni or a half circle goni. It's personal preference. I personally prefer to use a half, I think. So we'll go ahead and use this one. The only downside or disadvantage of this one, it is a little bit difficult to read exact measurements here, but we'll go ahead and try. So for this, you're going to go ahead and place the fulcrum between the malleoli right over here. The distal arm is going to be midline of the gastrocnemius right here, right?
Yeah. Posterior midline of the lower leg.
Of what? Lower leg. So it's going to be the midline of the posterior aspect of the lower leg right here. And you're going to go ahead and stabilize the calcaneus. It's kind of an awkward angle there, but make do with what we have. So right here. So find both malleoli, place the fulcrum right there. Find the midline of the gastroc right there. Place the patient into neutral. So it's going to be the midline of the calcaneus right here. So neutral for her will be about right here. Okay, so what I want you to do, go ahead and explain the motion you want to do. You can go ahead and do it passively. What I want you to do is turn your foot inside just like that, okay? Go ahead and zero her out. Right about there. It's neutral. Go ahead and perform that same motion. Foot in for me. Go ahead and relax. So let me try the other gun here. All right, go ahead and perform that motion. Foot in. So I would say right about there. And I got about 10 degrees, so she is pretty flexible there she is pretty flexible for inversion of the subtalar. About 10 degrees. I'm not sure if I'm doing it right. Huh?
What was it?
10 degrees?
Of what?
Inversion?
Eversion.
Eversion. Yes, eversion. That's right. Eversion, you're right. Eversion, because this is... Yeah, eversion. So now we're going to be doing inversion of the calcaneus.
That was inversion.
Subtalar. Huh?
That was inversion.
What?
That was inversion.
Okay, so you're confusing me now.
I thought it was flipped.
That's what I thought too. But I guess Eli gave me the wrong information. See what the book says. Okay. Well, anyway, we're going to go through this motion. So she's going to be pointing her foot out. So go ahead and point your foot out just like that. Have her go through the motion. Perfect. Go ahead and relax. Now you're going to go ahead and find both malleoli. That's where your fulcrum is going to go. This is going to be midline to the posterior aspect of the lower extremity right here. And you find 0, so you place her at 0, which is about right there. And go ahead and perform that motion where you punch your foot out for me. So this one is going to be a very minimal. All right, so there, she's about normal, which is about 5 degrees of eversion for the subtalar joint, right? Because the foot is going evert, because this is going in. This part goes in. Go ahead and do it again. Yeah, so I think this is inversion of the subtalar. What is that? Inversion. Also, it is a portion of the foot, right? Okay. Yes.
What is this one?
Huh? What? Eversion, which is what? Going out, yeah. Inversion going in. So it's the same. So just to confirm, go ahead. This is going to be inversion of the subtalar joint, and this is going to be eversion of the subtalar joint. So let's go ahead and just take one more measurement just to be safe. So once again, both malleoli, place the fulcrum right there. This proximal arm is going to go midline of the posterior portion of the lower extremity. The distal arm is going to be midline of the calcaneus right here. So go ahead and perform the motion where your foot goes in for me, please. So right there, you align it to the midline of the calcaneus. Go ahead and relax. So it's going to be the same. I did get 10 degrees as well. And we'll go ahead and check. Eversion of the subtalar joint. Malleoli, midline. All right, there. Go ahead and point this foot out for me. Find midline is about right there. Go ahead and relax. And same reading, about 5 degrees of eversion for the subtalar joints. And that is going to be range of motion and MMTs for the ankle. Next, we're going to go ahead and go over to the knee. Why? It's different? So that's inversion, and that's eversion.
Oh, okay, I guess I have to see it.
Yeah. See how it's kind of confusing during the motion without visualizing it?
It's because when I do inversion, I feel like this is going out.
I mean, it does look that way.
But then it goes in.
When you do it on me, you'll see. Okay, so next we're going to go ahead and do, since the patient is already in this prone position, we'll go ahead and do goniometry for hip extension. So for this one, you're going to go ahead and get your standard goniometry, the big old boy. And what you want to do first is go ahead and ask the patient to perform the motion just to see what is this for MMT. Oh, my bad. Okay. So it's going to be goniometry for hip extension. So what I want you to do is keep this leg nice and straight and go ahead and lift it up to the sky. And right here, you're going to stabilize the ipsilateral portion of the hip just to make sure there is no hip flexion. So go ahead and bring this leg up for me while keeping it straight, as high as you can go. So that's about as high as you go. So, okay. From here, you can go ahead and palpate her greater trochanter. So a good way to do this is place your fingers right here. You can immediately, laterally, and immediately rotate the leg until you feel that greater trochanter pop out. Sometimes you even need to do this. believe her greater trochanter is about right here, but just to confirm, go ahead and perform my motion.
Just the calf for the calf.
The calf. Okay. So you want to go ahead and grab the calf and then do that motion to find a greater, medially and anteriorly, laterally and medially rotate to find a greater trochanter. I don't feel it. Right there. Okay, so it's right here. As I internally rotate her leg, I can feel it pop right here. So we're going to go ahead and place our fulcrum right there. Proximal arm is going to go midline of her, what do you call that? Huh? Midline of the trunk. And the distal arm is going to be on the lateral epicondyle of the femur. So we're going to go ahead and zero it out and ask the patient to perform that same motion she did earlier. So go ahead and, while keeping this leg nice and straight, go ahead and lift it up to the sky for me. Right here, and go ahead and relax. So there's going to be adjustments you're going to need to make on both sides. So she did get about 14 degrees of hip extension. So it's within normal range. Normal range is between 0 to 20 degrees. And that, since the patient is already in this position here, we're going to go ahead and test for manual muscle. So once the patient's done rubbing her feet, you're going to go ahead and ask the patient. Huh?
Oh.
You can put your socks on now if you want. You're done with the ankle. Here.
Thank you.
Mm-hmm. So we're going to go ahead and ask the patient that same motion, which she did for the goniometry. As I said before, you're going to want to stabilize here. Oh, I should have done that for. So either way, you're going to want to stabilize at the hip. I'm not sure if I stabilize. So since I didn't stabilize at the hip, we're going to ask her to perform that motion one more time just to ensure that we did get an accurate reading. Same thing. Distal part of the tibia and fibula here to find a greater trochanter. Right here, feel it popping. Same thing, zero out. Find midline of the torso, lateral epicondyle. Stabilize here. Go ahead and pick your leg up to the sky while keeping that leg nice and straight. Hold. Okay, go ahead and relax. Go ahead. I got 19 degrees. All right, go ahead and perform that same motion. Leg to the sky. Go ahead and relax. So about 16 degrees. Okay, so manual muscle test, same thing. Go ahead and ask the patient to perform the motion. Go ahead and lift that leg for me. All right, you see she's able to go to full motion. So from here, you can either add the resistance here or here. You can tell this patient works out. So I'm going to go ahead and add the resistance over here. So since she's able to go to full range, you can take it to partial range. Keep that knee nice and straight for me. Right there. Go ahead and hold it. Don't let me move. Press down, press down, press down. All right, so she did not break. I would grade that a 5. Same thing. Go ahead and ask the patient to perform the same motion, leg to the sky with that leg, heel to sky with that leg nice and straight. So the patient did bend her leg a little bit. Go ahead and perform the same motion. All right, you see she's able to go through full range. So you're gonna go ahead and place the patient into partial range. I want you to hold this position right here. Keep the knee nice and straight. I want to add resistance. Don't let me move. Okay, don't let me move. Don't let me move. Don't let me move. All right, so she did break after some moderate resistance. After holding it for a little bit, so I'll grade that about a 4 plus. Same thing. Go ahead and it's gonna be a different grade here. Ask the patient to perform the same motion. So go ahead and bring that heel to the ceiling. We'll keep that leg nice and straight. So that's full range. You're gonna take her through partial range. About right there. I'm gonna apply some pressure. Don't let me move. Okay? Don't let me move. Don't let me move. All right, so she broke right away, so that's going to be a grade 3. Since you do see this grade, you're going to go ahead and ask the patient to go ahead and face me, please. Sideline. You're going to ask the patient to be placed in the sideline position. Scoot back to me a little bit. Here? Yes, that's going to be fine. You want to ensure that the patient is going to be in neutral alignment here. So I see that her torso is flexed a little bit. So go ahead and bring yourself back for me. There you go. And with this one, you're going to keep the lower leg slightly flexed. This is going to be for stability purposes. With this leg, you're going to go ahead and cradle it like a baby, stabilize it. From the bottom, you keep the leg straight, right?
I think it's the other way. So you're facing it.
Right, like this?
No.
Like this?
It's supposed to be the other way.
What do you mean?
So say you're doing the right.
No, because I'm going to go take you through range of motion to the top leg. Well, you're right. I was testing your right side.
No, you're testing the left.
So this is your right side.
Yeah.
So I had it right. Yeah.
Did you?
Yes. So there's different ways you can perform this grade, manual muscle grade, 0 to 2. The way I like to do it is have the leg that you're testing be on top. It makes it easier for the patient to perform the motion as well as the therapist to kind of guide the patient. So you're not moving the patient through the range of motion. You're just allowing them to move it. You're just stabilizing the leg. So same thing here. Posture is a little bit flexed. Torso is a little bit flexed here. So go ahead and straighten out the back of it, please. There you go. Bottom leg is going to be slightly flexed for stability. And you go ahead and stabilize the leg while maintaining it straight, just like that. Here, you see that you don't want any hip rotation. So you're going to stabilize here at the hip. And from there, you're going to ask the patient to bring her leg back just like that. Okay, so go ahead and bring your leg back for me. So you see here, she's able to go through full range. So that will be a grade 2. Same thing, make sure the patient is in neutral alignment with her spine. Stabilize here at the hip so there's no rotation. As well as stabilizing the lower leg underneath, cradling it like a baby. Go ahead and ask the patient to perform the same motion. So what I want you to do is bring your leg back just like that. As I stated before, you're not helping the patient go through the motion, you're just holding a leg here. So go ahead and bring your leg back to me, please. So patient is able to go through partial range. So that would be considered a grade 1 or 2 minus.
2 minus.
2 minus, that's right. So 2 minus. Yeah, 2 minus. So 2 minus is the patient's able to perform the motion through partial range. So same thing, we're going to go ahead and test again. Same thing. Stabilize the bottom leg right over here, as well as stabilizing the pelvis here at the, what is this called again? Iliac crest. Ask the patient to go through this motion right over here. Go ahead and perform that motion for me. So you see that she is not even able to go through partial range. So in this case, go ahead and lay on your stomach for me. You're going to place the patient into prone. Go ahead and scoot down a little bit for me, just so her legs are a little bit comfortable. That's a little bit too much, but that's okay. So we've been testing this right leg the whole entire time. So, huh? How about the right leg?
Left leg.
Oh, my bad. The left leg. So in this case, what we're going to do is we are going to pick up the leg here at the ankle. About, I don't know, 30 degrees? What does it say? 0 to... Oh, so you don't. So since she was not able to go through that full range, so she's going to be at least a 1 because I did see a little bit of muscle contraction here. And so you can let the patient know where you're going to be touching. So I'm going to be touching the back of your leg right about right here, just so I can palpate to see if there's any muscle activation. Is that okay with you? Okay, so I get the patient's consent. So I go ahead and find her hamstrings right here. And go ahead and try and lift up this leg for me. Go ahead and try again. So I do see a little bit of muscle activation. I did ask the patient to do it twice just to confirm that I did feel that muscle contraction as well as see it here. So since I did see that muscle contraction and there is no movement in the lower extremity, that would be a grade 1. For a grade 0, you can exact same thing. Go ahead and cue the patient. So what I want you to do is go ahead and lift your heel to the sky while keeping the leg straight for me, please.
What do you mean?
So what I want you to do is bring this heel up while keeping your leg nice and straight.
Oh.
So, huh?
Oh.
So, similar, I guess partial range. I would still consider that a grade 1. Not even partial range. She just lifted it up maybe about an inch or so. You did see some muscle activation right here. So that would be a grade 1. So, ask the patient to do the same thing. This is going to be a grade 0. So go ahead and bring your leg up without, bring your heel to the ceiling with keeping your leg nice and straight for me. Go ahead and do that. So there, you don't see any muscle activation, nor did I feel any muscle contraction. As a result, that would be a grade 0. So that is going to be manual muscle testing for the hamstrings. Do you want to do the bias too? Yeah. So we're going to be testing manual muscle. We're going to be go ahead and testing lateral and medial bias for the hamstring. So the lateral bias is going to be.
That's for knee flexion.
Oh, knee flexion?
What we're testing here is for glute medius with the.
Wait, so I did hip twice then?
What do you mean?
Did I do hip twice then?
If you flex the knee, you're hitting the glutes.
Oh, so I wasn't. So we're going to do glutes first? I'm going to do the lateral medial bias.
That's for.
Wait, so I did it wrong here. So all this, I was doing the knee, right? That's what I'm saying. I already finished it. Right? Oh, no. Wait, I went from ankle, we're doing knee next. So I actually skipped to hip. Okay, so ankle.
No, but what do you measure it to do?
Hip. Extension. Yeah, so we'll go back to the okay. So we'll go ahead and finish hip. So I did skip the knee. My bad. All right. So that was hip extension manual muscle test. Next, we're going to go ahead and do hip flexion goniometry. So for this one, you go ahead and ask the patient to lay in supine, which is going to be facing up. So go ahead and flip over for me where you're facing up, please. I have no idea where my gonio is. All right. So go ahead and extend your legs. So we're going to be doing the right lower extremity for hip flexion. Um, so for this, we're going to go ahead and find the same landmarks as we did for um, for measuring hip extension. So it's going to be, the fulcrum is going to be at the greater trochanter. The distal arm is going to be at the lateral epicondyle of the femur. And then the distal arm is going to be midline of, I guess you could do midline of the thigh, right? So midline of the thigh, or using the lateral epicondyle as reference. And the proximal arm is going to be midline of the, of the torso or the trunk. So same thing, we're going to go ahead and palpate for the greater trochanter, using the ankle to laterally and medially rotate until you feel the greater trochanter pop out. I'm sure you can see that right there. Whoa. Someone had some pretty good dinner, huh? So sometimes the patient will break wind. Don't let that affect you. Okay, so go ahead and help me for the greater trochanter. So I feel it pop out. What? That's not it. Right here, right?
Bigger.
Sorry.
It hurts.
This right here hurts.
Yeah, it's not right there.
I kind of feel it over here. What is that? That's not it.
Right here.
Okay. All right. Okay, I feel it right here. So be right, look at it right here. Similar to hip extension. Open right here. Proximal arm. Midline of the torso. Distal arm, midline of the thigh. And for this one, you're going to go ahead and ask the patient to go ahead and bring your knee to your chest. It's okay if you bend your knee. So bring your knee to your chest. There you go. All right, go ahead and relax your knee. So I got about 99 degrees. Would you agree? Just confirm. Let's do that one more time. Yeah, right here. Right here. Fulcrum. All right, go ahead and bring your knee to your chest room, please. It does seem like she did get a little bit more range right there. Okay, go ahead and relax. So she was able to get a lot more range. There you go, a lot more range.
It's already
Huh? Wait, I think I need to do one side here.
Should be about one.
Okay, so I got 107 degrees.
Yeah.
All right, so that was a pretty significant amount of increase. So let's test that one more time. That's a big difference. Same thing. Make the trochanter right here. Fulcrum. Proximal arm, distal arm. Okay, go ahead and bring your knee to your chest area, please. Alright, go relax. So about 105 degrees. So reverse, what happened the first time? Okay. So 105 degrees. So that's going to be hip flexion. Goniometry. Next, we're going to go ahead and do hip flexion. Manual muscle test.
Yeah. Sitting.
You should let me figure that out. I completely forgot how to do it there. So I measure your right hip, so we're testing the right hip too. So for this one, you're gonna ask the patient to perform hip flexion through her full range of motion. So you can go ahead and bring your knee to your chest. So you see that she's able to do full range motion there. That being said, take her to partial range, about right here, and place some resistance right here. Don't let me move, okay? Don't let me move, don't let me move, don't let me move. So she did break, so I would after some moderate resistance, so I would grade that a 4 out of 5. So same thing, go ahead and bring your knee to your chest. Go ahead and bring it down. You can see she was able to go through full range. For this one, the patient can stabilize with her hands out on the table. And for this, I stabilize right here, right? No, stabilize right here. So you're gonna want to stabilize here at the hip, just to ensure that there is no hip hike and she doesn't cheat. Any compensation patterns that are associated with this test to give you a false positive or a false negative, I guess you could say. Basically to change the results. All right, so she was able to go through full range of motion. So take her through partial range of motion, right there. I'm gonna place pressure right here. Don't let me move, don't let me move, don't let me move. That was supposed to be, I'm assuming, a grade 5, but she did break, so I'll probably consider that a grade 4 plus. So same thing, go ahead and stabilize the hip here. Go ahead and bring your knee to your chest. So she's able to go to full range. Same thing, take her to partial range. Don't let me move, don't let me move, don't let me move. So she broke fairly quickly, so I'll grade that a 3 plus, right?
Yeah.
Okay. So since she did break right away, so first that's what you would do sideline. No, okay. No, okay. So here, stabilize the hip again. Ask the patient to go to full range. So go ahead and bring your knee to your chest. So you see that she's not able to do that. You didn't even see any muscle activation here. That being said, you would want to put her in a gravity minimal position. So this is also going to be sideline. I'll have the patient face you. So you want the testing leg to be on the top part. All right. I still gotta do abduction, adduction, internal rotation, external rotation, the hips and arms. All right, go ahead. Ask the patient to scoot back. Go ahead and scoot back for me. Okay, so you want the patient in neutral alignment here. So just see that she is that way. You want to stabilize the hips here, so there is no rotation of the hip. Okay. And this one you do flex knee, right? What? It's flex knee, right? The hip extension, hip flexion.
For hip flexion?
Yes.
It was extended.
It's extended?
I think it's either or, no? Depending. If you flex it, kind of elongating the quad.
Yeah.
But
Right.
extended?
It's extended. So same thing, similar to hip extension. You want to maintain straight leg here. Stabilize at the hips so there's no rotation. Cradle the arm, the leg like a baby. Have the bottom leg slightly flexed for stability purposes. And you're going to ask the patient to bring her hip forward, her leg forward. So go ahead and bring your leg forward as much as you can go. So you see that she's able to go through full range there. So I would rate that a 2. What else? That's the only cueing I need to give, right? Oh, remember that you're not moving the patient through hip flexion. You're just there holding it for stability purposes. So same thing, go ahead and bring the leg up. You're going to ask the patient to go ahead and perform the motion of bringing her leg forward just like that. So go ahead and perform, stabilize the hip. Go ahead and perform that motion for me. So you see that she's able to go through partial range. So that's going to be a grade 2 minus because she is able to go to partial range in a gravity minimal position. We'll go ahead and test for another grade. Same thing. Stabilize at the iliac crest. Ask the patient to bring her leg forward just like that. So go ahead and bring your leg forward for me. So you see she is able to go. I did see a muscle contraction, but there was very minimal movement here. So in this case, you can ask the patient to go ahead and lay supine. So that's when you have the knee flexed. So it says here. Because you want to stabilize the calf. So for grades 1 through 0, right?
You just palpate.
Right. So I thought too.
Just palpate.
So go ahead and do the legs regular. Okay, so for grades 0 through 1, you have the patient in supine. Let the patient know where you're going to be palpating just so you can have permission. The patient is in alarm. So I'm going to go ahead and palpate right about here just to make sure that I do feel a muscle contraction. Is that okay? So you have patient's consent. So you palpate at her hip flexor. So it's going to be right here around the inguinal area. So go ahead and bring your leg up to the sky for me, please. So I did feel a muscle contraction as well as see some muscle activation here. As a result, I would rate her a 1 out of 5. So the next one's going to be a 0 out of 5. So same thing, ask for permission to palpate the muscle, the hip flexors. Go ahead and bring your leg up for me, please. So not only did I not feel a muscle contraction, I did not see any muscle activation here at the hip flexors. As a result, it's going to be a grade 0 out of 5. So that is the end of hip flexion. Now, abduction. All right. So for goniometry for abduction, you're going to ask the patient to be laying away from you, since I'm going to be testing her right lower extremity for abduction. So here, you're going to go ahead and place the fulcrum at the ASIS. So ask the patient for permission. I'm going to go ahead and palpate right here for a bony landmark, which will be right here at your hip. Is that okay? So go ahead and find it. Hers are pretty easy to find. There is a little bit of rotation of the hip, so you want her to go ahead and align your hips for her. There we go. So you're going to go ahead and place the fulcrum at the ASIS that is closer to you, or in the testing limb. The distal arm or the proximal arm is going to go to the opposite ASIS, and the distal arm is going to be midline of her thigh, using her patella as a reference. And for this, you want to ensure that the patient's foot is pointing up. You don't want any compensation techniques or patterns utilized during this test, because you are testing for glute Mead and min for hip abduction. Oh no. No, it's just range of motion. So for this is going to be active range of motion. So first go ahead and tell the patient to perform this motion here. You're going to be stabilizing at the testing, right? The testing ipsilateral hip. So you can stabilize at the ipsilateral hip so you don't see any hip rotation, so there's no cheating there. So go ahead and bring your leg out as far as you can comfortably go for me, please. That's it. Okay, so go ahead and relax. So for mine, I got 24. So 24 degrees of hip abduction. Next, we're going to be testing for hip adduction. So for this one, go ahead and ask the patient to slide towards you. Go ahead and extend both legs. You're going to place the non-testing limb into slight abduction. Same thing, you want to stabilize the ipsilateral. Her hips are rotated, so go ahead and bring your hips this way. A little bit more. There you go. There you go. So, non-testing leg and slight hip abduction. This testing leg is going to be in neutral alignment, toes pointing up. Similar to hip abduction, you're going to go ahead and place the proximal arm or the fulcrum, the testing leg ASIS. You're going to go ahead and place the proximal arm to the contralateral ASIS. Go ahead and zero out the patient. So she's already in neutral alignment. And from there, you can ask the patient to bring her leg in while stabilizing the ipsilateral hip to prevent any hip rotation or tilt. Zero out. Alignment. Okay, go ahead and bring that leg in for me, please. Bring this leg in for me, please. Right there. Go ahead and bring it out. Go ahead and bring it in. Right. Your words. Go ahead and bring it out. Go ahead and bring that hip in for me, please. Okay, right there. Go ahead and all right, go ahead and relax. So she got about 16 degrees of hip adduction. And that will conclude goniometry for hip adduction. All right. Next, we're going to be testing hip abductor MMTs. So ask the patient to go ahead and lie sideline. Go ahead and face that way for me. You're going to have the bottom leg flexed and the testing leg straight out. Go ahead and straighten out this leg for me. You're going to point your toes straight towards the wall. Here, make sure the patient is in neutral alignment. So go ahead and bring your torso back a little bit for me. Bring the bottom part back.
What?
Bottom part. Make you're leaning this way. So like that, but bring this part, just this part back. So here, you're gonna stabilize the hip over here. Ask the patient I want you to bring your leg up, just like that. As high as you can go. Go ahead and bring your leg up as high as you can go. Make sure your toes are pointing forward. Toes pointing forward that way. You don't want any external rotation or internal rotation of the leg. So go ahead and perform that same motion. Toes pointing forward, leg nice and straight. Bring your leg up to my hand or to the ceiling as high as you can go. More higher, 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 higher. All right, good. So you see that the patient is able to perform full range of motion. So from there, I'm going to go ahead and apply some resistance here at the distal aspect of her lower extremity. So you're going to take the patient into partial range. Hold it there. Don't let me move. Okay, I'm going to press down. Don't let me move. Don't let me move. Don't let me move. Okay, so that will be a grade 4 since the patient was able to break with moderate resistance. The same thing. Going to go ahead, do a different grade now. Stabilize here at the hip. Make sure your toes are pointing forward just like that. Keep that leg nice and straight. And what I want you to do is lift your leg up high as you can go. Like that. Okay, so go ahead and raise your leg for me as high as you can go. The leg nice and straight. Toes pointing forward. So you see the patient is able to go to full range. Same thing. Take the patient to partial range. Right about here. I'm going to apply resistance on your break. So since the patient did break right away, I would rate that a 3. So same thing, she's going to give me a different grade here. Stabilize at the hip. Ask the patient to go through this motion right here while keep maintaining a straight leg, toes pointing forward. Go ahead and perform that motion for me, please. There you go. So you see the patient is able to go through full range. So from there, you can take it to partial range. I'm going to go ahead and add some resistance. Don't let me move, okay? Don't let me move, don't let me move, don't let me move, don't let me move. So the patient did not break with maximal resistance. That would be a grade 5. She's going to give me a different grade now. So same thing, stabilize here at the hip. Ask the patient to perform this motion. Bring her leg up to the ceiling. Toes pointed forward, leg nice and straight. So go ahead and perform that motion for me, please. So you see that she's not even able to perform that motion at all. So in this instance, you're going to go ahead and put her at supine, long sitting, supine. It's only for TFL you do long sitting, right? Okay. So go ahead and extend your leg out for me, please. Go ahead and scoot over there to the edge of the table. So in this instance, you're going to go ahead and stabilize. Is that the contralateral side? Go ahead and do that motion. Contralateral side, right? Let's do the motion. Quick sheet. Do it. Cheat.
I don't know how to cheat.
I think it's a contralateral.
Hip,
Right?
It's super heavy.
It's hip secret. Wait, what? So it says here to hold, go ahead and straighten out your legs for me. So here, stabilize the ipsilateral part while stabilizing the lower leg too. So go ahead and bring your leg out towards me. So you see that the patient is able to go through full range. So that would be a muscle grade 2 out of 5. Same thing. You go ahead and support the leg down here and stabilize the ipsilateral side of the hip, and go ahead and bring this leg out towards me. And similar to grades 3 through 5, you want to make sure that the patient has her toes pointing up, that leg is nice and straight to prevent any compensating patterns. Go ahead and bring your leg towards me. So the patient is able to go through partial range. That will be a grade 2 minus out of 5. So she's going to give me a different grade here. Same thing, stabilize the ankle, make sure the toes are pointing up. Keep that leg nice and straight for me. Support the ankle and stabilize the ipsilateral side of the hip. Go ahead and bring your leg up towards me. So you see that the patient is not able to perform that action. So I'm going to be palpating your inner thigh right here just to see if I can palpate any muscle contraction. Is that okay? No?
No.
Huh? Oh, my bad. I apologize. On the outside of your thigh, okay? I keep on thinking of that motion. So I'm going to be palpating right here just to see if I can feel the muscle activation, okay? So same thing, stabilize the ankle, palpate here while stabilizing. Go ahead and bring that leg out. So I do feel a muscle contraction as well as seeing, muscle contraction as well as seeing some muscle activation. As a result, I'll grade that a 1 out of 5. So she can give me a different grade now. Same thing, stabilize or support the ankle, make sure the toes are pointing forward, keep that leg nice and straight, stabilize the hip as well as feel for muscle activation here at the side. Go ahead and bring that leg out for me. So there is no muscle activation nor any contraction of the muscle, so that's going to be a grade 0 out of 5 for a hip abduction. Next, you're going to be doing hip adduction, which I hate. So for this one, grades 3 through 5 is going to be in sideline. So we're going to be testing the right leg, lower extremity. So as a result, you want the patient's right lower extremity to be facing up. So instruct the patient to face, go ahead and face that way for me, please. Okay. Oh no, other way. So since you're testing the left lower extremity, you want the left lower extremity on the bottom. Huh?
Testing the bottom.
Yeah, you're testing the bottom leg. I don't know how to. There we go. Same thing, make sure the patient's in neutral alignment. So if she's not, go ahead and bring yourself back a little bit for me, please. You want to make sure these hips are nice and stabilized. You can stabilize here at the hip. So both legs are going to be nice and straight. So go ahead and straighten out your legs for me, please. Knees nice and straight. Neutral alignment right there. You're going to go ahead and stabilize this upper extremity. Bring it up into abduction. And from here, you're going to ask the patient to perform the motion of bringing this leg towards the other leg. So go ahead and bring that leg up for me, please. The bottom leg. Wait, go ahead and do it again. As you're doing this, you want to check for full range of motion. So go ahead and bring that leg up as high as you can go. And make sure that leg is nice and stabilized. Go ahead and come up. Not stabilized, nice and straight. So I'm assuming that is full range for the patient. Is it?
Yeah, I can't go further than that.
So I guess you don't need to bring this leg up too high into abduction. I was probably going a little bit too high here. So go ahead and bring that leg up for me. So right there, that's about right. So since you did see the patient going through full range of motion, that is at least a grade 3. From here, we're going to go ahead and add resistance. So you're going to bring that leg into partial range of motion. So right there, go ahead and hold that position for me. I'm going to be adding some resistance. Don't let me move. Don't let me move. Don't let me move. Oh. So that is a grade 4 since the patient was able to break what her hand placement.
Yeah.
Was it too low?
It was like on
higher?
the. I don't know how you placed it.
Yeah, so I was hitting your So you want to watch for hand placement there. Make sure you're not placing any pressure on any bony prominences right here, the medial epicondyle of the femur. So same thing. Go ahead and ask the patient to keep that leg nice and straight. You want toes facing forward, so make sure you are keeping an eye on that. Go ahead and bring this leg up towards the other leg for me, please. So patient is able to go through full range of motion there. Take it to partial range. About right here. Don't let me move. Don't let me move. Don't let me move. Don't let me move. All right. So patient did not break with maximum resistance. So that is a grade 5 out of 5. So now she's going to give me a different grade. Same thing. Stabilize here at the hip. Support the non-testing limb. Make sure this leg is nice and straight for me. Toes pointing forward. That leg nice and straight. Go ahead and bring this leg towards the other leg. Is that full range?
Yeah, sorry.
So the patient is able to go through full range. So as a result, you take it to partial range right here. Go ahead and hold that position for me. Don't let me move. I'm not resistance. Don't let me move. Don't let me move. So that is a grade 3. So the patient is going to go ahead and give me a different grade now. So same thing. You can stabilize on the bottom, upper extremity or the non-testing leg. Also stabilize here at the hip. Ask the patient to bring this leg up. Go ahead. Make sure you keep a straight leg. Toes pointing forward for me. Go ahead and bring that bottom leg towards the top leg for me. So you see that there is no. At least do partial range.
Huh?
At least do partial range.
Oh, partial?
At least, yeah, at least. All right, so you see that the patient isn't able to go through full range. It is partial range. So next we're going to go ahead and test grade 0 through 2. Ask the patient to lay supine. So go ahead and lay on your back for me. So we're testing this leg, right? So you want to be on the same side that the patient is being tested on. What the heck is this? You dropped the head part.
Really?
But for testing, for visual purposes, we're going to go ahead and be testing her left leg over here. There we go. Doing hip adduction. So with this one, go ahead and scoot towards me, please. There we go, right there. You want to put the non-testing limb into slight hip abduction or to hip abduction. Make sure her pelvis is mutually aligned. So go ahead and relax right there. And with this one, we're going to be, I'm going to go ahead and be palpating on the inside of your thigh right here just to see if I can feel any muscle activation, okay? So I do have, is that okay? So I do have permission to be palpating her hip abduction right here, as well as supporting the bottom leg. You want to ensure that her toes are pointing up and not internally or externally rotating here. Any compensation techniques. Keep that leg nice and straight. And what I want you to do is bring your leg in towards your other leg, okay? So go ahead and perform that motion. So you see that the patient is able to go through full range, muscle activation, contraction, and everything. So that is a grade 2 out of 5. Same thing. So the patient's going to give you a different grade here. So same thing. You want to make sure you stabilize his foot here. Make sure the toes pointed up. Keep that leg nice and straight. I'm going to be palpating on the inside of your thigh just to see if I can feel muscle contraction. So go ahead and bring that leg towards the other leg, please. So patient is able to go through partial range of motion. So it's going to be a 2- out of 5. Same thing, patient's going to give you a new grade. Exact same cues. Palpation. Go ahead and bring this leg towards the other leg for me, please. So I do feel muscle activation here, as well as muscle contraction. As a result, that's going to be a grade 1 out of 5. Last grade is going to be 0. Ask the patient to perform same motion. So palpation right here. Go ahead and bring this leg towards the other leg. So you see that the patient is not able to perform a muscle contraction, nor did I feel any muscle activation. As a result, that's going to be a grade 0 out of 5. So now hip internal and external rotation. Okay, so now we're going to be performing goniometry for hip internal rotation. So in this position, you can ask the patient to go ahead and sit up. Huh? You want to do anything to help? You do that lazy? Really? Are you tired? You still gotta do yours too. Unless you don't want to. Well, I mean, you're lucky that you don't have to do it till freaking Thursday. You got calls on? Yes. All right. So for hip internal rotation, which day do you want to test? Doesn't matter. So we'll go ahead and be testing her right lower extremity for hip internal rotation. So for this, we're going to go ahead and place the fulcrum, at the mid patella. The proximal arm is going to be aligned with the surface of the table. And the distal arm is going to be aligned with the midline of the anterior portion of the lower extremity. Here you can ask the patient to go into neutral, which is right there. And since we're testing for hip internal rotation, you can ask the patient to perform this motion right here while stabilizing the lateral, the distal portion of the femur. So go ahead and zero out, place the patient into 0. All right, so go ahead and perform that motion I just told you to do. So go ahead and relax. So the patient was able to get to 20 degrees of internal rotation. Yep. Okay, now we're going to go ahead and perform manual muscle tests for hip internal rotation. So ask the patient to perform the motion. You know what, let's do hip external rotation before we do manual muscle tests. Because I know there's going to be great turnout. No, we're all great at this. Yeah. Alright, so we're going to be testing for hip external rotation. So same thing, you're going to place a fulcrum mid patella. Distal arm is going to go midline of the anterior aspect of the lower extremity. And the proximal arm is going to be aligned with the surface of the Okay, so what I want you to do is go ahead and So go ahead and bring this leg in as far as you can go and stabilize the distal end of the femur. So go ahead and bring that leg in. Go ahead and relax. So the patient was able to get to 29 degrees of hip external rotation, internal rotation, external rotation. External. So let's use hip internal.
Yeah, you're right.
But you did this one here. So it's hip external rotation. So what was it again? 39 degrees? Okay. So now we're going to be doing some manual muscle tests for both hip internal and external rotation. So go ahead and stabilize the distal end of the femur. Ask the patient to bring her leg out as far as she can comfortably go. It's going to be testing for hip internal rotation. So go ahead and bring that leg out for me. All right, so you see the patient's able to go through full range of motion. As a result, I'm gonna go ahead and be applying some resistance. So you're gonna be stabilizing the lateral aspect, the medial aspect of the distal femur. Take the patient into partial range. Go ahead and go to full range for me again. All right, so partial range is about right here. We're applying resistance right here. Don't let me move that leg in, okay? Don't let me move, don't let me move, don't let me move. All right, so patient did not break, so that's a grade 5 out of 5. Then go ahead and stabilize here. Bring that leg out for me. All right, perfect. And patient's able to go to full range. Stabilize the medial aspect of the femur. And take it to partial range. I'm gonna add resistance. Don't let me move. Don't let me move. Don't let me move. Don't let me move. Sweet. So grade 4 out of 5. Since the patient didn't break after moderate resistance, then go ahead and bring that leg out for me, please. So the patient is able to go to full range. Take it to partial range. Stabilize the medial aspect of the distal femur. Go ahead and add resistance. Don't move, don't move. So the patient did break, so that's going to be a grade 3 out of 5. And then go ahead and stabilize the distal aspect of the femur. As the patient to go to full, to bring her leg out, so she can go to full range. Go ahead and bring that leg up for me. So the patient, just like so the patient did not perform that action to full range. So as a result, she'll be in supine. But before we go into supine, we're going to go ahead and test for hip external rotation. So with this, go ahead and stabilize the distal end of the femur. Ask the patient to bring this foot towards the other foot. Go ahead and do that for me, please. There you go. So the patient is able to go to full range. So that's needs 3. So with this portion, you're going to stabilize the distal aspect of the lateral, like the lateral aspect of the distal femur. And go ahead and perform the motion, take it through mid-range. You can apply resistance on the medial aspect. And don't let me move, don't let me move, don't let me move. So grade 5, same thing. Go ahead and bring this foot towards the end. All right, so patient able to go ahead and breathe in. Patient able to go to full range. Take it to partial range. Don't let me move, don't let me move, don't let me move. So patient was able to break with moderate resistance, grade 4. Same thing, go ahead and bring this leg towards the inside of the leg. Full range. Take it to partial range, apply the pressure of the lateral aspect, medial aspect of the distal tibia. Stabilize here. Don't move. Patient broke our way. That's a grade 3. So now we're going to be testing for grade 0 through 2 of internal and external rotation. So go ahead and lay supine for me, please. So just slightly out. So we're going to be testing for hip internal rotation.
How to do these.
Huh?
That's not you ask them, no?
What?
If they can do
Yeah, internal rotation. So for this one, you're going to instruct the patient to bring their leg in just like that. And see if the patient could go through full range of motion. Okay, we've been doing this for an hour and 40 minutes. Okay, so go ahead and bring this leg in for me, please. So you see the patient is able to go through full range of motion, so that's going to be a grade 2 out of 5. Same thing, you're going to ask the patient to perform the motion of internally rotating. So go ahead and perform that motion for me, please. So patient is able to go through full range. That is 2 out of 5. What was the first one?
Yeah, 2 out of 5.
Yeah, so both of them 2 out of 5, right? All right, so ask the patient to perform that motion right there. See the patient go through full range. Go ahead and perform that motion for me, please. So patient is able to go through the partial range. So that's going to be a 2- out of 5. Same thing. You can ask the patient to internally rotate the hip. Has to be shown what the motion you want. So go ahead and perform that motion for me, please. So patient is not able to perform that motion. As a result, I do want to palpate for her internal rotators, which are going to be on the medial aspect of the inner thigh. So I'm going to go ahead and palpate for these muscles right here, okay? So go ahead and palpate right here. Ask the patient to perform this motion right here. So go ahead and bring this leg in, or turn your leg in for me, please. So I go ahead and do it one more time. One more time. Do it again for me. So both lateral, external, internal rotations right here. Okay.
Really?
That's what's in here.
So what's internal, the glute med?
Yeah.
Sorry, I didn't find a group or device named Movie.
And external also. Do external rotation? External rotation. External rotation. External rotation. External rotation. External rotation. So external rotation. Do internal rotation. Okay, so you'd be palpating the lateral aspect just above the greater trochanter. So you're going to ask the patient to perform this motion right here. Go ahead and perform that motion for me, please. So patient is able to perform that motion, so it's going to be a grade 2 and 5. Go ahead and perform that motion for me again. Rotate that leg inside. So patient did partial range, so it's going to be 2 minus and a 5. Go ahead and perform the same motion. Go ahead and bring that leg in for me, please. So there is no movement. I do feel muscle contraction as well as visualizing that muscle activation. Or I do feel muscle activation as well as seeing the muscle contraction. It's going to be a grade 1 out of 5. Ask the patient for she's going to be a different grade, so go ahead and perform that motion. We'll bring that leg in for me, please. So I don't feel any muscle activation, nor do I see a muscle contraction. As a result, it's going to be a grade 0 out of 5. So for hip external rotation, we will be palpating the lateral aspect of the leg as well. So make sure that the patient is in neutral hip alignment. So go ahead and bring this leg out for me, just like that. Go ahead and bring that leg out for me. Do it. So for hip external rotation, go ahead and stabilize make sure that there is no external rotation the patient is performing. So go ahead and perform this motion for me right over here, please. Go ahead and perform that motion. So go ahead again. So patient is able to go through full range in a gravity minimal position. So that's going to be a grade 2 out of 5. So same thing, go ahead and bring that leg out for me, please. So patient did go through partial range, it's going to be 2 minus. Go ahead and perform this motion for me, please. So 2 minus, partial range. Go ahead and perform the motion again for me, please. So patient did go through full range, that's going to be a 2. Go ahead and bring that leg out for me, please. Alright, so there is no muscle activation there, so that's going to be a grade 0 to 5. One more time, go ahead and bring that leg out for me, please. So 0 to 5.
For which one?
External
Did
rotation.
we go through all of them?
No, you didn't give me one.
Oh, shoot. Okay.
Alright, go ahead and perform that motion again. So I did feel muscle activation as well as see muscle contractions. That's going to be grade 1 out of 5. So that's going to be the end of manual muscle test for hip external rotation. That's it for the hip, right?
Yeah.
Now for knee. Finally. Okay, so this patient is in supine position. We're going to be go ahead and testing knee flexion. You started at 0, right? And then you measure. So for this, you're going to be using. You're going to be using greater trochanter as the proximal arm. Lateral epicondyle as the fulcrum, and midline of the lateral aspect of the lower extremity, and using the lateral malleolus as a guide. So first, we can go ahead and palpate for the greater trochanter, internally rotating. So I'm just going to your right here. Your interface is right here. Orbital is going to be go ahead and keep the position straight. So you're going to instruct the patient to bring your knee to your chest while keeping this foot flat on the table and not lifting your heel. Right? You started in neutral position, right?
Yeah. Just like heel butt.
Yeah, so heel to butt while keeping that foot flat on the table. There you go. Greater choke transfer. Lateral condyle and lateral malleolus. Right there. So patient was able to perform. You got a lot of.
Black.
Right over. So it's 132. So patient did get 132 of hip knee flexion, right?
I guess so.
What do you mean you guess so?
Started here. Right? Went here. Yeah, do it again.
Go ahead and make the leg. So instruct the patient to bring heel to butt. Go ahead and bring your heel to butt. No, keep it flat. You got a lot more that time. 142. No?
Sure.
What is it normally? What'd you get in the low with that thing? Why did you do it again?
I don't know.
What's the butt? 135, 136. You got more before. You can get more. So next we're going to do goniometry for leg extension. So this is your sitting up, right? This is your long sitting. Your supine. I'm pretty sure you're long sitting.
Oh, am I? Here we go.
I'm pretty sure. Where's
Messed up. Picture.
Knee rotation. What? Let me get supine. No, that's deflection. Or knee extension. Alright, go ahead and put your hand over here. So next you're going to be doing knee extension. This is so much to remember. Do you remember all this?
Not everything.
Go ahead. Place a bolster here. Same landmarks as knee extension. Flexion. Lateral condyle. There, zero out. Ask the patient to go ahead and make a muscle here. Lift up this leg. Relax. The patient was able to get 4 degrees of knee extension.
For this one, what if they're like already in extension? Do you take a picture? Or what?
Yeah. Go ahead and relax. Test it one more time. One more test, one more time. When you're ready, go ahead and alright, go ahead and lay down. What? Higher, 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 higher. Bring that leg up. So weird. Very relaxed. Go ahead and bring that leg up. Bring it up, 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 up. Bring it up, 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 up. So I got like 3 degrees. Yeah, like 3 degrees. So that's it, right? So now for manual muscle. Okay. Huh? I think they're both sitting there. Alright, so we're gonna go ahead and do knee flexion manual muscle test. Go ahead and sit. I forgot how to do extension. I forgot how to do extension. Flexion. Alright, so we'll be testing this lower extremity. Ask the patient to go ahead and keep the toes up, bring the leg to the sky. You see the patient able to perform full range of motion, so it's 3. So take the patient to partial range of motion, go ahead and point your toes up. Don't add resistance, don't let me move, don't let me move, don't let me move. It's a 5. Go ahead and relax. Go ahead and bring your toe up. Bring your leg up. Alright, full range, go ahead and relax. Toes up. Take the patient partial range. Apply resistance. Don't let move. Don't let move. Don't let move. 3. All right. So go ahead and bring toes up, leg up, all the way up. There we go. Go ahead and relax. Toes up for me. Take the patient to partial range. Apply some pressure. Don't let move. Don't let move. Don't let move. So that's a 4. Go ahead, toes up, leg up. Great. Full range. Go ahead and relax. Toes up, partial range. Partial range. Go ahead and hold that. Don't let move. Don't let move. So that's about a 4 plus. All right, go ahead and put your toes up, leg up for me as high as you can go. So a patient cannot do that. At least give them partial range. There you go. Partial range. That sideline also.
Is it sideline? Yeah.
Yeah. Go ahead and go. So you instruct the patient with the testing leg up, right?
I think it's down, no?
Not testing leg up.
It's testing like this.
Yeah. So instruct the patient to stay on the opposite side. Go ahead. Face the TV.
Oh, that's right, because she wants to stabilize, right? To like hold it while they do it.
So for this one, you can keep the bottom leg flexed. You're going to be stabilizing. Go ahead and stabilizing the top leg over here. The top leg. What I want you to do is perform this motion for me, okay? So you're going to be also stabilizing the distal ankle. So go ahead and bring that leg out for me. So patient is able to perform full range of motion. So that's going to be a grade 2 out of 5. All right, so what I want you to do is perform this motion for me. So go ahead and perform that motion for me whenever you're ready. So patient is able to go through partial range. So it'll be 2 minus out of 5. I want you to perform this motion for me. So go ahead and perform that motion. So I do not feel any muscle activation. As a result, you want to put the patient into prone position. So doing supine. So go ahead and lay it on your back for me. Legs extended. So with this one, we're gonna ask the patient to perform a quad set. So what I want you to do is make a muscle right over here, okay? So whenever you're ready, go ahead and make a muscle for me. So patient is able to make a muscle. I do see the contraction as well as feel the muscle activation here. So that's gonna be a grade 1 out of 5. Go ahead and patient's gonna give me a different grade now. So go ahead and make a muscle right over here. Patient is not able to perform that motion. I did not feel muscle contraction, nor did I see any muscle activation. So that's going to be a grade 0 out of 5. So next we're going to be testing knee flexion. This one, you're going to ask the patient to perform a hamstring curl. So I want you to perform that motion for me with this leg. Patient is able to perform full range of motion. As a result, you take the patient into partial range of motion. And what I want you to do is resist the force that will be applied. Okay, resist. So patient did break a little bit, so that would grade that a 4 plus out of 5. So go ahead and ask the patient to perform that same motion. So I want you to bring your heel to your butt. Patient is able to perform full motion. Go ahead and relax. Take patient to partial range. Go ahead and hold that. Don't let me move, okay? Don't let me move. So patient did break, so it's going to be a 4 out of 5. Patient's going to be a different grade. Go ahead and bring your heel to your butt. Perfect. Go ahead and relax. You take the patient to partial range. Add resistance. Only move. Okay, only move. So patient broke. It's going to be a 3 out of 5. Bring your heels to your butt. So patient is able to perform full range of motion. So you're taking a partial range right here. Add resistance. Only move. Okay, only move. So patient did not break. That's going to be a 5 out of 5. Okay, patient may be different grade. So bring your heel to your butt, please. So patient was not able to do that. As a result, you're going to want to put her inside line with the testing leg up. So go ahead and face me, please. Okay, this is so much. Oh. So testing leg is going to be up. Go ahead and instruct the patient to come closer to you. Go ahead and come closer to me, please. So you're going to want to stabilize the leg this way right here. So what I want you to do is go ahead and bring your heel to your butt, okay? So go ahead and instruct the patient to perform that motion. Go ahead and bring your heel to your butt, please. So patient is able to perform full range of motion. So that's going to be a 2 out of 5. Go ahead and perform that motion of bringing your heel to your butt for me, please. So patient was able to go to full range. That's going to be 2 out of 5. Go ahead and perform the same motion for me, please. Heel to butt. Patient was able to perform partial range. So it's going to be 2 minus out of 5. So what I want you to do is bring your heel to your butt. So I do not feel a muscle contraction. As a result, ask the patient to lie prone. So go ahead and lay on your stomach. So for testing purposes, we'll go ahead and I'll perform on the other extremity so you're able to see. Actually, I'll just do it here. So as a result, you want to palpate for the hamstring here. Ask the patient to bring her heel up, or so you can stabilize here at the heel. Go ahead and bring your heel to your butt, please. So patient I did feel some muscle activation as well as seeing muscle contraction. As a result, that's going to be a 1 out of 5. Same thing, you can stabilize here at the distal part of the ankle and make sure the hip is in neutral rotation. Go ahead and perform that motion for me. Bring your heel to your butt. So slight contraction, it's going to be 1 out of 5. Same thing, neutral hip. Go ahead and bring your heel to your butt for me, please. So there is no muscle contraction nor activation. As a result, it's going to be a 0 out of 5. All right, it's your turn. No, okay. You can take off.